There's two things necessary for an addiction to occur. One, of course, is that you have to have an underlying diagnosis. It could be just as simple as anger, anxiety, stress. Um, Even more serious would be something like ADHD or bipolar, depression. And then the worst, of course, would be post-traumatic stress syndrome. All of these things affect how the body is processing endorphin. And it's critical that you have a harmonic balance and that it's done in conjunction with all your other systems. And if it's out of control, for example, an alcoholic has an overactive opioidergic system, so we use medications to slow things down or shut it off. The exact opposite is true for an opiate. We have an underdeveloped opioidergic system and we have to bring it back to normal. And so this is why we have to do an original assessment to figure out what's going on and what is currently going on with the endorphin system. The leading precursor to opiate abuse has been marijuana because the active ingredient, THC, across the top of the brain, there's 11 or 12 of them, but it's connected to the left side of the brain where you have the mu receptor, and mu is the receptor for opiates. So as an alcohol, you're stimulating the kappa alpha receptor, you're going to go the alcohol route. If you smoke a cigarette first, your chances of later getting addicted, if you do, 72% of the time it'll be the alcohol. If you smoke marijuana first and later become addicted, 92% of the time it'll be to opiates because you pre-stimulated those receptive areas.